A recent survey of nurses on PEI found that 90% had experienced violence in the workplace, and more than half do not feel safe at work. This violence at times was reported to be very serious in nature. Broken bones, choking, spitting, kicking, and punching were among some of the violence that these nurses have endured as part of their jobs. A question to the Minister of Health and Wellness. Since this report was made public in September, who have you consulted with, and what immediate actions have you taken to keep our nurses and patients safe?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker, and I'd like to thank the Honourable Member for this very important question. I have previously met with the President of the Union for the Registered Nurses, Mona O'Shea. Mr. Speaker, just this past week I was down in Montague and met with the all of but two of the ER nurses in that facility, Mr. Speaker, to have discussions around this. Mr. Speaker, quite often I'm visiting long-term care facilities, constantly engaging with frontline staff, Mr. Speaker, on this and many other issues. Mr. Speaker, I'll continue to do so, and we're working collaboratively with all stakeholders to ensure that any serious incidences such as this are addressed. Thank you, Mr. Speaker.
The Honourable Member from Tyne Valley, Sherbrooke.
Thank you, Mr. Speaker, and I am glad to hear again that discussions are underway. However, there needs to be an outcome from discussions, a plan to move forward. What are the next steps? I truly believe that you want to work toward improving the safety of nurses in PEI, I do. And I believe that doing this is going to require actions starting now, and also a solid long-term plan. Question to the Minister of Health and Wellness. Can you table any evidence to show that your government has a plan to ensure the safety of nurses in PEI now and in the future?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker. Mr. Speaker, I'd love to present a plan right here on the table for the Legislative Assembly today. But, Mr. Speaker, you can't just pull a plan out of the air. You have to have discussion. You have to have dialogue. You need to understand what the issues are, the contributing factors towards such violence or behavioral issues within our hospitals and our care facilities, Mr. Speaker. Until you understand what the issues are and how to best address them, you cannot produce a plan. So, Mr. Speaker, that's the process we're going through right now, the consultative process, so that we can develop a plan with these frontline allied healthcare workers. Thank you, Mr. Speaker.
The Honourable Member from Tyne Valley, Sherbrooke, your final question.
Thank you, Mr. Speaker. So absolutely, discussions need to continue, consultation throughout, and plans need to grow and develop and change as you continue to have conversation. However, as you are developing plans, you need to start somewhere, and it is time that we are actually starting somewhere on these key issues. 90% of nurses experiencing violence require some immediate action. An increase in staffing resources could be very effective in limiting some of the violence in the workplace that's taking place. Evidence shows that when there is enough staff to adequately and safely care for patients, violent episodes decrease. A question to the Minister. Will you be increasing the number of nursing staff, especially in areas with higher rates of violence, such as mental health and long-term care facilities?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker. Mr. Speaker, right now the action we're taking with regards to recruitment of nurses, we have a group of 10 international nurses going through a 13-month program right now. January through March, they're going to be doing their practical. There's another 20 international nurses right behind them waiting to take this program as well. Mr. Speaker, we are now going to be increasing our return to service incentive to our nursing graduates coming into the system to help better recruit them here to this province, Mr. Speaker. So yes, we are doing a lot of work with regards to increasing the complement of nurses here in Prince Edward Island. Thank you, Mr. Speaker.